The United States Border Patrol is responsible for preventing terrorists from entering the U.S. and enforcing immigration laws. Tonight, Not on Your Side has an all-access pass to Border Patrol emergency medical training. Agents volunteer to train for a program that gives them more skills to save lives. Since October, agents have rescued 160 illegal immigrants. With photographer Chris Miracle, we follow agents becoming EMTs.
Within the Department of Homeland Security, the Border Patrol is one of the largest medical entities as far as having number of people that are trained.
Buddy, are you all right?
We begin here in the classroom with Border Patrol agent and instructor Gerardo Carrasco. He teaches a class on EMT training.
Intact.
Okay. Down to the abdomen, do I have any rigidity or distension?
Assessing a patient's injuries, treating injuries immediately, and determining who needs life flight immediately. Right now, we have 4,000 Border Patrol agents in the Tucson sector. 200 are EMTs, with more being trained every few months. The Border Patrol says the need for these specially trained agents is great.
Well, aside from being out there in the environment, being exposed to the elements, a lot of times they're functioning by themselves or with a very few other people, so they have to be able to prioritize some of the treatment they're doing, be able to recognize any of these life-threatening injuries and stabilize them quickly. Very limited manpower, limited access by conventional EMS, extended response time sometimes, so they're going to be on scene with these patients for a long time.
This training is strictly voluntary. Agents have to take 7 weeks of classes in addition to their regular workloads.
Is my scene safe? BSI? Yep. Do I have any obvious deformities to the head or anything? Negative. Mechanism of injury? Assault? Chest injury?
Classroom demonstrations prepare agents for all scenarios.
We get the conventional, they're dehydrated, they've been exposed to the elements, but also something as minor as bumps and bruises, blisters, all the way up to motor vehicle accidents, gunshot wounds, broken bones, things like that.
This intense training goes beyond the classroom into the desert on the Davis-Monthan Air Force Base.
Today we have a scenario called Med Wars that we had adopted from the military.
Med Wars is meant to simulate the sweltering Sonoran Desert for agents dealing with emergency after emergency, and sometimes the agents themselves become the patients.
Basically, he fell back out of a helicopter while fast roping operations were being conducted, and both his legs are injured and is unable to move. Both four-star EMTs are treating the patient as we speak for all minor and life-threatening injuries.
Keep in mind, agents are patrolling a large desert area. Part of the challenge is finding the patients that are in desperate need of medical attention, and that's where EMTs come in.
They're getting lied to as far as how much water they're going to need. They're never going to bring enough water, especially for the amount of the distance they're going to be walking, the heat, all that. They're never going to be as prepared as they need to be.
Many of our rescues do take place during the summer months, and many times what these individuals who are crossing don't understand is the terrain that they will face, the rugged, harsh terrain that they will face.
The next scenario is a common one along the southern Arizona border.
In this scenario, the agents are going to come up. It's a simulated vehicle accident rollover. They're going to come up, find the patient. He's not going to be talking to him. They're going to treat him as they see fit, given the tools that they have with them.
Pulse? What's his pulse? Checking his pulse. Radial. We're going to have high flow O2 on that as well. What's his blood pressure?
This particular scenario involved an agent that got sick, was not hydrated enough, and became sick in the desert, and they went ahead and took care of her.
Our EMTs are trained to do IV therapy, EpiPens for allergic reactions, and advanced airways, which are outside the parameters of what regular EMTs provide.
Here, agents practice precise use of the IV for rehydration, one of the many life-saving skills.
We wear many hats. We do enforce the immigration laws down on the border. That being said, we also have a very strong humanitarian role that we try and employ. When it comes to giving those necessary medical resources and those needs, that is our first priority.
Special thanks to the U.S. Border Patrol for the all-access pass inside EMT training. For more information on this story, you can log on to KGUN-9.com. And stay with us. Your weather forecast is up next.